from the outset, it was a grassroots development. It started as a medical clinic in the basement of one of the Kool-Aid shelters.
To me, health is always linked to basic human needs. Of course, housing and shelter are key among those. And so anything I could do to dovetail health services into a group which is already effectively running emergency shelters, supportive housing sites, made a ton of sense.
Victoria is an incredible city to live in and has become increasingly more and more difficult to sustain housing in. That the rates for rentals have gone up so much. And, homelessness is a huge piece of substance use. Since Christmas 2015 is the beginning of our overdose crisis here, of the toxic drug supply, and really the introduction of fentanyl and then carfentanil into this community. We've just reached 10,000 people that have died since this crisis has, been around.
Kool-Aid does a lot. It's part of the Victoria Kool-Aid Society. We have a multidisciplinary health center, and we have about 6,500 patients, which includes outreach healthcare clinics in our supportive housing sites and our shelters, as well as an outreach van.
First time I met Chris Fraser, my doctor, I was on the street, and I'd gotten a cellulitis in my ankle from missing, and I had a big abscess. We developed a really good working relationship and friends. He's personable. He looks in your eye when you're speaking with him. He's willing and patient to go through what is needed to see things through.
When you have worked with someone across 10, 20 years, that becomes a real privilege of the relationship of primary care. The good times, the bad times, and really in some ways as a primary care provider, you feel most privileged when the person comes and tells you some of the hardest things they're going through.
First time I got Hep C, I was 23, I think, 24. My partner and I at the time, we were both young, pretty naive to the dangers of using. As far as diseases, infections. The second time I got diagnosed just 2 years ago, 2020.
So we're very proud of our nurse-led model here. What it means is that the nurses take ownership of our hepatitis C treatment program, and we coordinate all of that. So that means potentially planting the seed in a patient, saying that we can offer hepatitis C treatment, all the way to drawing the blood work, doing the screening, filling out the pharmacare applications for medication treatment, getting funding for those patients, filling out the fair pharmacare forms, getting the deductibles paid for. It also includes sorting out treatment with local pharmacies at the pharmacy that they chooses to use, as well as how the patient chooses to take those medications, either daily dispense with delivery to where they're staying, either in the shelter or in our housing support sites. It also includes intensive case management.
Tamara is fantastic. I go to see her to get blood work, make sure to manage my HIV, make sure that my CD4 count is good and my viral load is good. I've been undetectable for the last 15 years.
So Dean is someone we came in contact with through the sheltering sites that happened through COVID. He got tested for Hep C and found out that he was living with it. And shortly thereafter, he was one of over 100 people that we've treated in those sheltering sites. We approached him afterwards to see if he'd be interested in doing testing to join our peer testing team, and he was thrilled at the idea.
So this weekend, there was a Community Connect. We were there doing the hepatitis C tests. I drum up the business a little bit because I kind of know a lot of people. Fiona, she does the paperwork. When I do the fingerprint, and then we give them $10 and it takes about 10 minutes.
I believe in housing first, meeting people's basic needs. Again, food, access to medical, getting basic needs met, teaching life skills. I have known Joey since, I think, 2015. He wouldn't access medical care before when I knew him back in 2015. It wasn't accessible as it is now. Here we have the medical van that's right outside his door once a week, sometimes twice a week, and he's always out there, you know, getting things that he needs, taking care of himself, going through the hepatitis C treatment, and the change has been phenomenal.
When I was drinking, I could really tell that the Hep C was bothering me. Well, to be Hep C free, it is a real bonus because, you know, I mean, everybody needs your liver. And in my head, I just knew I wanted to get rid of it, right? And you can tell the difference, like, your liver is like, it's almost like you can almost feel a smile in there now. It's kind of nice, eh?
So since the introduction of DAAs in Victoria, Kool-Aid Health Centre has treated about 500 patients successfully.
I think nurses are really tenacious around supporting people exactly where they're at, understanding the social context around, doing that sort of case management piece.
In terms of helping people to engage in healthcare, whether it's around substance use, mental illness, hepatitis C, or their HIV care, I think you can't underestimate, again, these relationships.